Good morning, everyone. I am Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Drug Use Trends Annual Update with Ben Hackworth. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address them as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel as well. If you continue to experience poor audio through your computer, try rejoining the webinar or use the call-in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website within 30 business days. To access a recording or a PowerPoint, go to www.fada.org and then to our Resource Center and then onto our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will need to register or sign in to an account to complete the evaluation. Information you provide FADA as a part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes, an individual professional development journal. For persons completing the evaluation and attending the full webinar, completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note that the evaluation will close at midnight on Friday, December 17th. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not complete the entire webinar, and we are not permitted to provide partial CE credit. Benjamin Hackworth has over 4 years of experience providing community presentations, technical assistance, and training on substance use and mental health prevention services. As an independent contractor, he collects, analyzes, and evaluates data for local, state, and national dissemination through written reports and oral presentation. And now I'd like to welcome our presenter, Ben Hackworth. I will turn the presentation over to you.
Thank you, Rebecca, for the introduction, and good morning, everyone. I hope everyone's having a great morning so far. We're going to be going over patterns and trends in substance use in Florida, and this is our annual update report. So the objectives today will be going over the 4 waves of the opioid epidemic. Hopefully, we'll be able to understand patterns of substance use regionally and statewide. We'll hopefully understand morbidity and mortality trends in Florida and also understand prevention strategies for substance use. Just an introduction for for this presentation. This is an update from the 2021 annual report. And you can find the annual update report on FADA's website as well. And again, we're going to be discussing the 4 waves of the opioid epidemic and its relation to national and statewide specific data. The data sources used for today's presentation is used by the Center for Disease Control and Prevention, the Florida Health Charts sponsored by Florida Department of Health, and also the 2020 interim report from the Florida Medical Examiners Commission's data. At the time of this presentation was sent in, we only had the interim report, but the annual report for 2020 has been published. So the presentation goes over January through June data, but since we have all of 2020 now, I'll be updating that information orally for you as well. So the Florida Department of Children and Families, DCF, contracts with 7 regional systems of care known as managing entities to provide behavioral health services throughout the state. Because Florida is such a large state with a diverse population, this model allows each managing entity to respond to specific behavioral health needs in all of its regions within Florida. Overall, the managing entities can be split into 7 different regions. So to quickly go over these, we first have the Big Bend community-based care in blue. It's the smallest population of 1.5 million people and makes up about 7% of the state, but is dispersed throughout a larger region. We have Lutheran Services Florida, which makes up the northeast part of Central Florida in yellow. The Central Florida Behavioral Health Network serves the largest population with over 6.1 million people and 28% of Florida's population. Central Florida Cares is in orange, serving about 13% of the population. We have Southeast Florida serving 10% of the population. Broward Behavioral Health Coalition serving about, just Broward County. And then South Florida Behavioral Health Network, only serving 2 counties, but making up 13% of the state's population. So when we talk about our managing entities throughout the presentation, these are the regions that I'll be referring to. Okay, so we're going to be talking about the opioid overdose waves throughout this presentation to get a better understanding of how we got here and where we all started with the opioid epidemic. So nearly 500,000 people have died from overdoses involving any opioid, including prescription and illicit opioids from 1999 to 2019. The rise in opioid overdose deaths can be outlined in distinct waves. The first wave began with an increase in prescribing of opioids. The second wave began when there was a rise in heroin overdose deaths. And the third wave started when we started to see deaths involving synthetic opioids, particularly illicit manufactured fentanyl. So I like this graph better that has an overview of the opioid overdose waves. It shows a better picture of the timeline of overdose waves and when they started. And you can see in 1999, we saw an increase starting with prescription opioid deaths marked in blue. And this was the start of the opioid epidemic. This graph only stops at 2017, but we know that prescription opioid deaths have decreased nationally since 2017 for 2018 and 2019. The second wave is the green line, which began in 2010 with the rapid increases in overdose deaths involving heroin. Heroin overdose deaths have also decreased for 2018 and 2019 nationally, that the graph doesn't depict here. But in 2019, we had just over 14,000 overdose deaths involving heroin. The third wave of overdose deaths involved illicit manufactured fentanyl, which started in 2013. But you can see the significant increase each year starting in about 2015. And it continues to rise each year, unfortunately. In fact, overdose deaths involving synthetic opioids were nearly 12 times higher in 2019 than in 2013. More than 36,000 people have died from overdoses involving synthetic opioids in 2019. And so the experts in the field are calling on to a fourth wave to the opioid epidemic, which started around 2014 with a rise in opioid and stimulants, such as cocaine and methamphetamine. And you can see that that line is in yellow. So polysubstance use of opioids and stimulants are causing an increased rate in overdose deaths. All psychostimulant deaths, primarily methamphetamine, whether it be in combination with synthetic opioids or without any opioids, contributed to more than 16,000 deaths in the US for 2019. Deaths involving cocaine with or without synthetic opioids resulted in more than 15,000 deaths in 2019. The rise in opioids and stimulants comes most likely to the availability and the amount of production that's being used in being made in Mexico and China, and all of these supplies coming to the US. There's also been research on how psychostimulants are made available in the same environments that opioids are being sold as well. So to go over the first wave in more detail and how we got here with the opioid epidemic, pharmaceutical companies pushed prescription opioids on healthcare providers and stated that patients would not become addicted. These prescription opioids were used to treat moderate to severe pain and often prescribed after surgery or some type of injury. However, prescription opioids became a problem when prescribing rates skyrocketed among healthcare providers. This led to a widespread misuse of these medications. Roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them, and about 8 to 12% of people who use an opioid for chronic pain develop an opioid use disorder. In 2019, 10 million people misused opioids in the past year. And according to the NSD-UH survey, which surveys the nation on different substance use questions. They asked about where sources for pain relievers were obtained from people who misused opioids. And the most common answer was that they received these prescription opioids from either a friend or relative for free, or from one of their doctors. So lots of prescription opioids are being misused, and most of the common prescription opioid overdose deaths involved methadone, oxycodone, and hydrocodone. When we look at the opioid dispensing rate in the US and Florida, we can look at this graph, which depicts the rate per 100 persons per year from 2006 to 2020 for the US and Florida. After a steady increase in 2006, the total number of prescriptions dispensed peaked in 2012 at more than 255 million opioid prescriptions, and a dispensing rate of 81.3 prescriptions per 100 persons. You'll notice Florida had a higher dispensing rate the same year in 2012 with 87.6 prescriptions per 100 persons. However, national and state opioid dispensing rates declined from 2012 to 2020. The Prescription Drug Monitoring Program, PDMP, was established in Florida and helped keep track of controlled substances and prescriptions and put a limit on the number of prescriptions written. Continued education and expansion of the PDMP continued to help opioid dispensing rates to decrease. The US and Florida have similar dispensing rates as of 2020, with 43 prescriptions per 100 persons and a total of 142 million opioid prescriptions nationwide. In 2020, Florida had 10 counties with more than 60 prescriptions per 100 persons. So there's a few counties in Florida that still have a higher dispensing rate than the state in general. And when we look at this graph, it shows Florida controlled substance dispensing rates per 1,000 population in 2020. The rate is for 1,000 people for those 18 and older in each county in Florida. The lowest prescription opioid rates are shaded in blue, and the higher rates are shaded in dark blue. So we'll see just from the map here that higher rates of prescription opioids per 1,000 population in the northern Florida region is higher than in some of the southern counties. And the Big Bend community-based care region had the highest prescribing rate among other regions at 677 per 1,000 population. So prescription drugs, specifically opiates, are shown here. And again, this is from the medical examiner's interim report, which only reports January through June 2020 data. Like I said at the beginning of this presentation, this is only half of the annual report, but now we have all of 2020 data published from the medical examiner's data. So this is already outdated because it just came out, I think, 2 weeks ago. So in the meantime, to explain this chart, methadone deaths are in red, hydrocodone is in orange, and oxycodone deaths are shown in green and stacked on top of each other in this bar graph separated by each managing entity. Let's see, there were 1,187 oxycodone-related deaths in Florida for all of 2020. Hydrocodone deaths reached 487 deaths for 2020, and there were 372 deaths from methadone. Oxycodone has plateaued with the number of occurrences over the past 3 years, and hydrocodone has been the lowest it's been for the number of occurrences from the past decade. When we look at prescription opioid deaths by managing entity, we can count the number of deaths by rate per 100,000 population by region. And this rate is from the interim report and indicated that the Central Florida Behavioral Health Network had the highest amount of deaths per 100,000 population. And when we talk about prescription opioid, we can try and have some prevention specifically for prescription opioids. These strategies help with prevention, and some of them include academic detailing, which consists of structured visits to healthcare providers by trained professionals. And they provide tailored training and technical assistance helping healthcare providers use best practices. They use guidelines for prescribing opioids for chronic pain and also use education on addiction and risks for addiction in these healthcare settings as well. Usually, academic detailing helps improve opioid prescribing rates and also patient education. There's also prescription drug campaigns such as drug take-back days. These educate the public on safe storage and also provides availability for disposal of prescription medications. There's also a policy change that we can implement. Pill mills were an issue in Florida back in around 2011, and we created the Pill Mill Strike Force. These pill mills were pain clinics that inappropriately prescribed large quantities of prescription drugs to patients. And the Pill Mill Strike Force helped reduce the number of pills being prescribed by doctors and doctor shopping as well. The PDMP was actually created in 2009 and was signed into law after Senate Bill 462 was signed by the governor. And in 2010, 90 of the top 100 physicians purchasing oxycodone in the US were actually in Florida. So lots of policy change to help with these prescription opioids were made into law. And the PDMP and the pill mill laws have been shown to be effective, although in modest declines from pre to post law implementation. Now we can move on to the second wave of the opioid epidemic, which started in around 2010 with an increase in overdose deaths involving heroin. So when the availability of prescription opioids began to get harder with legislation and policy change that we just talked about, more attention was being brought to the media and national news about prescription opioid deaths. And so it became harder to get prescription opioids, and we already had a nation of people who were addicted to opioids. And so unfortunately, this shift, there was a shift in heroin use then. And so that's why we started to see a increase in heroin deaths. Um, with the shift from prescription opioids to heroin, around 4 to 6% of people who misuse prescription opioids transition to heroin, and 80% of people who use heroin first misuse prescription opioids. Overall, throughout the same time period of 1999 to 2019, in the US, nearly 130,000 people have died from an overdose related to heroin. In 2019, heroin-involved death rates decreased over 6% from 2018 to 2019 in the US. And in Florida, heroin-involved deaths have remained stable as of 2019. For 2020 data, we'll see a decrease actually in heroin deaths. In Florida as well, heroin-involved death rates per 100,000 population in 2018 was 3.5, and in 2019, the death rate stayed the same at 3.5 as well. But like I said, in 2020, we'll see a decrease in heroin involved deaths. So this chart is heroin-related deaths in Florida from 2001 to the first half of 2020 with the interim data that we had at the time. The the peak of heroin deaths you can see is observed in 2017 and has since decreased. So there were 844 heroin-related deaths reported for 2020. So this is about an 11% decrease from 2019 to 2020 for heroin-related deaths in Florida. Here we have heroin-related deaths in Florida from January through June. About 84% of deaths with heroin also had another substance involved at the time of death, and 84% of the deaths with heroin were the cause of death. The age range that had the highest amount of deaths were 35 to 50-year-olds. When we look at heroin related deaths by managing entity, again, this is only for the interim report from January through June 2020. You can obviously see the number of deaths is highest in Central Florida Behavioral Health Network. And all counties except for 2 had less than 10 occurrences with a rate per 100,000 population. And the only 2 counties that had higher rates than this were both in the Big Bend region. So I also want to make note that since heroin is rapidly metabolized to morphine, this may lead to a substantial overreporting of morphine-related deaths and an underreporting of heroin-related deaths. The annual report states that for 2020, there were 1,632 morphine-related deaths. Since there were a higher number of deaths from morphine, the occurrences per 100,000 population were higher throughout the state than compared to heroin. This graph is the top 10 occurrences, top 10 co-occurring substances among heroin-caused deaths in 2020. We'll see morphine as the top co-occurring substance, but again, that's probably due to the metabolism that gets broke down in the decedent. So the second top co-occurring substance with heroin was fentanyl with about 82%. And then we see codeine and cocaine, fentanyl analogs, and so on and so forth. So when we talk about prevention with heroin, we're assuming that people are already using heroin. So these will be specifically for heroin use. So secondary and tertiary prevention for heroin would include medication-assisted treatment, or MAT, which is the use of medications, most likely methadone and buprenorphine, in combination with counseling and behavioral therapies. Studies have shown that outcomes are much better when you are on medication-assisted therapy. For one, it decreases the risk of relapse. And two, MAT also has been shown to be effective in preventing infectious diseases like HIV. A good majority of people who use heroin administer this drug using needles. This turns to the harm reduction prevention and the importance of syringe service programs. According to the CDC, nearly 30 years of research has shown that comprehensive syringe service programs are safe, effective, and cost-saving, and do not increase illegal drug use or crime. They also play an important role in reducing transmission of viral hepatitis, HIV, and other infections. So far, there's 9 counties in Florida that have taken steps for implementation to have syringe service programs. Expanding access to and use of naloxone is also important for heroin prevention. Pharmacies, community-based organizations, first responders, treatment centers, and even criminal justice facilities should have naloxone available just in case for any use available, and also having Good Samaritan laws, which protects any volunteer giving aid to an injured person in any emergency situation. And in this case would be during a suspected overdose. And anyone using naloxone or rescue breaths for a suspected overdose, these Good Samaritan laws protect the volunteer who's helping the person with the suspected overdose death. So all of these are helpful when dealing with heroin overdoses. Okay, so now we can move on to the third wave. which is synthetic opioids, specifically fentanyl. So fentanyl was first developed in 1960 as a powerful painkiller and surgery anesthetic without side effects of nausea. It's 100 times more potent than morphine and up to 50 times stronger than heroin. It's prescribed in controlled settings for the most serious conditions, such as to treat cancer pain. Synthetic opioids like fentanyl began to increase in overdose deaths in 2013. The landscape for illicit fentanyl continues to change with its analogs. Fentanyl analogs are being manufactured uh, in labs, and so the structure and the compounds for fentanyl gets changed all the time. Combination with other substances is also becoming an issue with fentanyl. So, like we said, the fourth wave has had an impact with fentanyl being infiltrated in the drug supply and being used with other drugs as well. And then we also have counterfeit pills that are being made um, thinking that they are being sold as maybe Oxycontin or MDMA, but there's fentanyl in these counterfeit pills. Synthetic opioids, including fentanyl, are now the most common drugs involved in drug overdose deaths in the US, actually. In 2017, 59% of opioid-related deaths involved fentanyl compared to 14.9% in 2010. In 2019, more than 36,000 deaths involved synthetic opioids occurred in the US. Synthetic opioid-involved death rates have increased by over 15% from 2018 to 2019 and accounted for 73% of all opioid-involved deaths in 2019. The rate of overdose deaths involving synthetic opioids were more than 11 times higher in 2019 than in 2013. And in Florida, there was a 34% increase from 2018 to 2019 among synthetic opioids related deaths in Florida. With the new data that we have for 2020, there was a 63% increase in fentanyl occurrences between 2019 and 2020 in Florida. Every day in 2020, about 15 people died each day with fentanyl in Florida as well. This graph shows fentanyl and fentanyl analog related deaths in Florida from 2007 to the first half of 2020. So there were 2,838 fentanyl related deaths and 905 fentanyl analog related deaths for the first half of 2020, which meant that if we estimated the total amount for 2020, it would be over 7,000 deaths. However, we now know for the annual report for 2020, there were a total of 7,785 fentanyl and fentanyl analog related deaths for 2020 in Florida. So this means that the state of Florida saw a 53% increase in fentanyl and fentanyl related or fentanyl analog related deaths from 2019 to 2020. From the interim data, we see that there's a huge amount of fentanyl that is also being used with other drugs, with about 93%. And fentanyl is becoming more potent as well. So with fentanyl use, about 92% of deaths with fentanyl was the cause of death. Fentanyl analogs are also highly used with in combination of other drugs with 99.8%, and 47% of deaths with fentanyl analogs were were considered the cause of death. The age of descent for both fentanyl and fentanyl analogs were the same age range that the Florida Medical Examiner age range puts together. So those who are 35 to 50 had the highest death rates for both of these substances. When we look at fentanyl and fentanyl analog related deaths by managing entities, we see the disbursement throughout the regions in Florida. Big Bend Community-Based Care had the lowest number of deaths, but this region also has the smallest population. And so therefore, if we go by rate per 100,000 population, Big Bend still had the lowest amount of deaths per 100,000 population. And the highest region was Southeast Florida Behavioral Health Network with 29.6 deaths per 100,000 population. Again, this is for only January through June 2020 though. Co-occurring substances among fentanyl caused deaths in 2020 is shown here. The top co-occurring substance was cocaine with 44.3%. This is followed by fentanyl analogs and then alcohol for the rounding up the top 3 co-occurring substances for fentanyl caused deaths. The top 10 occurring substances among fentanyl analog caused deaths in 2020. The most used substance was fentanyl, and then cocaine at about 50%, and then morphine rounding up the top 3. For fentanyl prevention, we can talk about how surveillance for opioid overdoses is really important to track the ever-changing illicit opioid market. So having surveillance on what types of fentanyl and their analogs are being in the drug market is really important to track, and having forensic toxicology testing of these drugs is also important so that we know the different analogs that are being created and being used out on the street market. It's really important to understand when there's a high amount of specific drugs being used at any specific time. Routine clinical drug screens should should include screening for fentanyl exposure as well. And this allows for early warnings of supply contamination and the best sources of surveillance from the local drug market. Fentanyl strips are also helpful for those who think they're getting one drug but are actually they might have fentanyl in their drug supply. So having fentanyl strips is really important for those who are already using these substances. And obviously naloxone and medication-assisted treatment is also helpful for fentanyl prevention as well. The fourth wave of the opioid epidemic is polysubstance use and involving psychostimulants such as cocaine and methamphetamine that's being mixed with opioids. In 2014, deaths involving cocaine or methamphetamine mixed with an opioid began to rise, and starting the new wave of the drug epidemic. Like opioids, stimulants are medications available by prescription for treatment of certain conditions such as narcolepsy. In spite of their medicinal use, however, stimulants can also be misused. In addition to prescription stimulants, several illicit stimulants are also drugs of abuse. Cocaine is highly addictive stimulant that's associated with adverse health effects such as overdose and death. And fatal drug poisonings due to these stimulants have been increasing recently across the nation as well. Florida has experienced a nearly parallel rise with the US for cocaine-caused deaths, rising much of the first decade of the 21st century and ending the decade with a return of lower rates for a few years. However, the rates began to rise again beginning in 2013. Rates of cocaine-caused death in Florida have been consistently higher than the US, although Florida did see a decline in these deaths from 2017 to 2018. That did not occur nationally. The rate of cocaine-caused deaths in Florida was about 6 per 100,000 population in 2018, compared to 4.5 deaths per 100,000 population nationwide. Traditionally, there's been higher rates of cocaine in the southern regions. However, an abundance of cocaine is being produced and distributed across the nation and other regions of Florida, with not only opioids causing a high amount of drug deaths, but stimulants causing a high amount of drug deaths across Florida as well. Cocaine and methamphetamine overdose deaths have been on the rise in the US and are now involved in more deaths than either prescription opioids or heroin, respectively. Research has documented the rapid growth of cocaine and methamphetamine deaths due to cutting or mixing fentanyl into the drug supply. Between 2013 and 2019, deaths involving cocaine tripled from 4,939 to 15,863. And deaths involving methamphetamine quadrupled from 3,616 to 16,127 deaths. In 2019, 63% of all stimulant deaths also involved an opioid. Provisional data from the CDC provide a look into the overdose toll for 2020, and deaths involving cocaine increased by 21%, and methamphetamine rose by 46% in 2020. Between 2013 and 2019, deaths involving cocaine increased from 1,337 to 3,675 in Florida, while deaths related to methamphetamine spiked from 169 to 2,080 in 2020 within the same within Florida. Florida rate of death involving cocaine also exceeds the national rates as well as of the last annual report. So we're going to go into cocaine-related deaths in Florida, and this graph shows cocaine deaths in Florida from 2001 to the first half of 2020. We see a rise around 2006 to 2007 in cocaine-related deaths in Florida, but then we see another increase in 2016, 2017. For this graph, we now know that for 2020, there were actually 3,675 cocaine-related deaths for 2020. And this is a 24% increase from 2019 to 2020. From the interim report, cocaine-related deaths from January through June, we see that about 90% of the deaths with cocaine involved a combination with other drugs. About 66% of deaths with cocaine were the cause of death, and the age range with the highest deaths were between 35 and 50-year-olds. Cocaine-related deaths in Florida by the managing entities is shown here. Again, this is from the interim report from January through June. So we see some outliers here. So we see lower rates in the Big Bend community-based care versus the highest rates in Central Florida Behavioral Health Network. However, when we go by rate per 100,000 population, Broward Behavioral Health Coalition had the highest among all the regions. They had the highest rate of deaths per 100,000 population with about 11 deaths. Looking at co-occurring substances among cocaine-caused deaths in 2020, the top substances among cocaine-caused deaths was fentanyl with about 75%. And then we see alcohol and fentanyl analogs as well. And then we'll go into methamphetamine-related deaths in Florida. So this graph shows methamphetamine-related deaths from 2000 2004 to the first half of 2020. And we see the continual rise of methamphetamine in Florida. So there's been a huge amount of methamphetamine being produced in Mexico and being dispersed throughout the US. Methamphetamine has been predominantly higher in western states, um, and also has been higher in the panhandle of Florida. For the first half of 2020, from the interim data, we estimated 1,924 methamphetamine-related deaths. However, now that we have the annual report, it stated that there were 2,080 methamphetamine-related deaths, so more than we estimated for 2020. With these final numbers, there was a 46% increase in the number of deaths from methamphetamine from 2019 to 2020. Methamphetamine deaths in Florida is shown here from January through June. There were 98% of deaths with methamphetamine involved in combination with other drugs, and 46% of deaths with methamphetamine were the cause of death. And the age of descent was the same range that we've seen with the other substances, with the highest range of 35 to 50-year-olds having the highest death rates. Methamphetamine-related deaths by managing entity is shown here. There's differences that you can see here from the regions, and a higher number of occurrences has been seen in the Big Bend region, the Lutheran Services Florida region, and also Central Florida Behavioral Health Network. Whereas there's been a lower number of methamphetamine-related occurrences in the southern regions of Florida. However, for the 2020 annual report, we see that the amount of deaths doubled in some of these southern regions, such as Broward Behavioral Health Coalition and the South Florida Behavioral Health Network. Although the deaths there have been historically lower, the death rates for 2020 have doubled, which make it concerning for these regions. When we look at the deaths per rate per 100,000 population, again, we see Big Bend community-based care having the highest with 8.9 deaths per 100,000 population. And then also having Lutheran Services of Florida having the second highest with 7.3 deaths per 100,000 population. The co-occurring substances among methamphetamine caused death in 2020 was amphetamines. This is most likely due to the fact that methamphetamine can be metabolized into amphetamine, which is probably why that percentage is so high. But the second most co-occurring substance was fentanyl, being used with methamphetamine at 67%. And cocaine was the third top substance being used with methamphetamine as well. I think this is a good place to stop, Rebecca, for a break, if that's okay with you.
That sounds great. Okay, everyone, we will take a 5-minute break and we'll be back at 11:05. Okay, welcome back, everyone. We are going to pick up where we left off. And Mr. Hackworth, if you are ready, I will go ahead and I will pass the presentation back over to you.
Okay, great. Thank you. Okay, so we talked about polysubstance use with opioids and methamphetamine and cocaine. With polysubstance use, we can talk about prevention strategies. Currently, there's no effective medications, however, to treat cocaine and or methamphetamine addiction. However, there are behavioral therapies that recognize social, family, and other environmental factors that has been shown to be effective for individuals who misuse these substances. And more interventions are being researched to explore specifically reducing cocaine use using pharmacological interventions. However, the following interventions are used for stimulant use disorders. So there's motivational interviewing, contingency management, community reinforcement approach, and cognitive behavioral therapy. The outcomes achieved by these therapies include reduced use of stimulants, reduce risky behaviors while using stimulants, and reduce mental health symptoms while using stimulants. Another big issue that we're dealing with the opioid epidemic has obviously been the COVID-19 pandemic. An acceleration of increase in drug overdose deaths occurred from March 2020 to May 2020 in coincidence to the COVID-19 shutdowns. This may have been due to the isolation and so forth for drug users and accelerated overdose deaths. Provisional data from the CDC recorded over 81,000 drug overdose deaths in the US, which is the highest number of overdose deaths for a 12-month period ending in May 2020. Although overdose deaths were increasing before the COVID-19 pandemic, the latest data suggests overdose deaths have escalated during the pandemic. Synthetic opioids, primarily illicit fentanyl, has been a huge reason for these increases in overdose deaths. And also the CDC has now predicted with recent reports that there were 93,000 overdose deaths in the US for 2020. The CDC is already predicting that the number of overdose deaths for 2021 will exceed 100,000 people for overdose deaths. From July 2019 to July 2020, there was a 24% change increase in drug overdose deaths in the US as well. So the early stages of the pandemic, we definitely saw higher percentage of change in overdose deaths with some of the data that the CDC has put out. Again, the COVID-19 pandemic has overshadowed the access and availability of treatment and policies to combat the opioid epidemic. The CDC suggests expanding distribution and use of naloxone and overdose prevention education, as well as awareness about the access and availability of treatment for substance use disorders. They recommend to intervene early with individuals who are at high risk for overdose and improve effectiveness of response to overdose outbreaks. As you can see here in this map, Florida has been considered one of the states that had over a 20% increase in overdose deaths before and after the COVID-19 pandemic from 2020. A lot of the states within the US have also seen this huge increase in overdose deaths as well. So Florida is not the only state to experience this. In Florida, predicted cases of drug overdose deaths in 2019 was 5,127 deaths, but had a 38% increase in 2020 to 7,579 provisional drug overdose deaths for the current 12-month reporting period of July 2019 to July 2020. Provisional data in Florida also indicates an increase in suspected non-fatal drug overdoses during the pandemic, especially months of April through September. And Florida had the second highest number of overdose deaths in the US compared to other states by pure numbers, not looking at population per 100,000. When we look at age-adjusted drug overdose death rates in the US and Florida, we have for 2019, Florida is higher for age-adjusted drug overdose deaths than that of the US rate, with 25.1 rate per 100,000 population versus 21.6 for the US. As you can see here as well, Florida has been higher than the US, except from 2012 to 2015. But in general, Florida drug overdose rate has been historically higher than the US. According to the Florida health charts, opioid mortality rate in Florida has increased in 2019. Unfortunately, we don't have all of 2020 data in yet, but we're expected to see another increase in opioid mortality rate for Florida. Again, according to the Florida health charts, when we look at drug overdose deaths in Florida, the data in Florida health charts has not been updated for the whole annual report. So as of January through June 2020, there were 3,708 drug overdose deaths. And we now know that according to the Florida Medical Examiner's data, that there were over 7,000 drug overdose deaths. So with this, we know that 2020 will have an increase from 2019, making it a 35% increase in drug overdose deaths in Florida from 2019 to 2020. When we look at opioid overdose deaths in Florida, this is harder to explore the data because we have to look at the raw data to see what drugs were used at the time of the drug overdose. And so again, we don't have all the data in for 2020. But as of January through June 2020, we had just over 3,000 deaths specifically for opioids in Florida. And we're expected to have a higher rate when we get those 2020 numbers in from 2019. So to recap, we talked about the opioid epidemic waves, the first one being overprescribing of opioids that led our nation to misuse and addiction. We talked about the second wave of the opioid epidemic, which was heroin, that was being used as a replacement for these prescription opioids after they became more restricted. The third wave of the opioid epidemic we are currently dealing with synthetic opioids such as fentanyl and are driving the current opioid epidemic, contributing to the majority of drug overdose deaths. And then we talked about the fourth wave of the opioid epidemic, which are opioids in combination with psychostimulants such as cocaine and methamphetamine, which has caused what drug experts are saying is the fourth wave of the drug epidemic. And then we discussed overdose rates during COVID-19 and how, although drug overdose deaths were on the rise before the pandemic also escalated overdose deaths in the early stages of the national shutdowns, indicated by the 2020 overdose data that we have. All this data highlights the need for increased prevention by expanding awareness and also the importance of harm reduction when it comes to drug use, and also expanding availability and access to treatment across the state for substance use. These are the resources that I used throughout this presentation. The Florida Alcohol and Drug Abuse Association FADA has really great resources and materials and publications on their website that you can visit. Has really helpful information. The Florida Department of Law Medical Examiners Commission, I highly recommend everyone go to this link and just look at the data. They have maps of Florida that has the highest rates of substance use deaths within the state. So you can find your county and see the death rates. Specifically, when I looked at this data from the medical examiners, the fentanyl maps are quite astonishing to see how much fentanyl how much fentanyl deaths are in Florida. There's also the Florida Drug Related Outcomes Surveillance and Tracking System, which is really helpful for specific county data. There's iSave Florida, which has a really great naloxone access and availability tracker to see where you can get naloxone in your region. And then some prevention toolkits and stimulant use disorder information from SAMHSA. And then lastly, the substance use dashboard, which is also really helpful when looking specifically in Florida for substance use data. So Thank you so much for listening to my presentation on different types of substance use data in Florida and also the US. I hope the information was helpful and that you learned something new today. Thank you, Rebecca, and I think we can take questions now.
Excellent. So if anyone has any questions, you can go ahead and post them in the chat and I can read them to Ben and he can try and answer them the best he can. Okay, Ben. Oh, I see one that just came in. Ben, what is the age category in this fourth wave that you believe will be the most prevalent? Do you have any insight on
That's
that
a
at this point?
that's a really good question, actually. I don't know the age category, but based on the data that we went over with just cocaine, methamphetamine, and fentanyl, all of those deaths, specifically in Florida, were that 35 to 50-year-old age range. And just for like a disclaimer, I guess, the Florida Medical Examiner Commission, that's just one of the age ranges that they have. So they go by um, their age ranges go by less than 18 years old, 18 to 25-year-olds, 26 to 34, 35 to 50, and then those over 50 for um, age of the age of death. And so, like I said, that 35 to 50-year-old age range has consistently popped up for most of these drugs, or yeah, for most of these drugs. So I suspect that would be the age range, but I can't say specifically.
You had another question, Ben. Do you know what caused the decrease in the stats that you mentioned in 2017 and 2018?
Oh, yeah, so I don't know the specific causes for the decrease, but that's really interesting because the in Florida and also the US um, saw a decrease in 2018. Um, I don't know if there was more prevention strategies and more availability of naloxone being more widely used, possibly. Um, but I think that uh, that might have been a contributing factor to the decreases. However, since we're seeing such high increases in 2019 and 2020, those are the leading factors for that are the potency of fentanyl. So the fact that fentanyl is becoming more potent and more dangerous and just like being infiltrated in our drug supply, um, maybe the potency or the drug supply for fentanyl wasn't as high in 2018. Um, so that those are some possible reasons for that.
Thank you, Ben. And then do you happen to know which population was most impacted by the opioid deaths?
Um, is that the only which popu?
Population by race or gender?
Oh, okay. Um, so there's there's been reports that people of color and minorities are having higher rates of opioid overdose deaths as of 2019 and 2020. I don't know overall if they are having the highest, but I know that for the past 2 years, they've had the highest spike in overdose deaths. So um, people of minority groups are having um, higher rates of overdose deaths that we need to pay attention to because historically, overdose deaths have been people um, who are considered white and an, an older age range. However, we're seeing higher rates in those who identify as Black and those who um, identify as Latinx, Latino, Hispanic. They're having higher rates in the past 2 years than white, than those who identify as white.
Well, thank you, Ben, so much. And I will go ahead and conclude the webinar unless you have anything else you'd like to add, Ben.
No, I just thank you for all the questions. I hope I answered them thoroughly for you, and thanks again, everyone.
All right, everyone. We have included Ben's contact information so that you may contact him with any further questions. Ben, once again, we really thank you for all the work you put into this. You did great. Thank you so much for all the information you shared with us. Please see the chat panel for today's survey. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FADA's website. If you would like to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, please provide an accurate Florida Department of Health license prefix and number when you register. After you register or sign in, you will be directed onward to the evaluation. Please use the same email address you used when you registered for today's webinar through our WebEx links. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be messenger@webex.com. Please note the evaluation will close Friday, December 17th at midnight. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile after 30 days. Thank you for your interest in this program, and thank you for participating in today's webinar. We'd also like to recognize and thank the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day. Thank you all.